Aloha, everyone. I am here at the Neutral Zone. I am here with Dr. Lorrin Pang, our special guest. He was on only a couple of weeks ago, but with all that's happening in our world, we thought we'd have a special edition. We had enough time after Thanksgiving to see what's going on with traveling and Thanksgiving and COVID and the vaccines, where we'd have a juicy show for you. There's a young lady in Tennessee who was on an Apple call with me, and she was talking about wanting everyone to wear masks. What do you think about that idea, Dr. Pang?
Well, yes, that's good. And well, don't forget, but it's been at first, the CDC and the feds were really against it, way back when.
Really?
And there were three reasons. One, they didn't think it worked too well and gave a false sense of security. The second reason was if we all wore masks, we might take the mask intended for the healthcare workers. And so there'd be a shortage. But then there was a big effort to talk about cloth masks. And the final reason was if you wear a mask, you play with it so much, putting it off and on and all that, that you end up touching the outside and then smearing it from your face into your eyes. So don't forget, a point of infection is mucous membrane. So those were the three reasons.
But don't you also change mask every time you go anywhere? You got to keep changing?
Depends which mask you wear. Some is good for a day or two as it plugs up with your own
like this
stuff that you breathe out. Yeah,
this is what I see.
That one, yes. But listen, in Hawaii, any mask, mine or yours, I claim that you leave it in our ambient, not air conditioned, ambient temperature and humidity. The germs, the COVID germs, shouldn't live more than 5 or 6 hours. Now on the mainland, it might live 3 or 4 days. So maybe you should change and wash the mask. But in Hawaii, so yeah, I have 2 masks or 3.
When we say live, I don't want to go off on a virus thing, but yeah. Viruses are living, but they're not alive. Is that important to know in any way? They'll go away. They become less powerful, less invasive.
Okay. That statement is true, but my statement that in our Hawaii's ambient humidity and temperature, the viruses, let's just say, disappear. Now, a lot of times in the mummies of Egypt or very cold and dry places, the viruses go dormant. And when you heat them up or warm up, they come alive and can invade and do what they're dormant. My claim is that in Hawaii's ambient temperature and humidity, not air conditioned, they go away. They're not dormant. They're consumed by the bacteria in 4 to 5 hours.
Wow, okay.
So now in Hawaii, if you just have 2 masks, you leave one sitting, then you wear the other one, then you switch off. Now, when it gets plugged up from all your exhalation and you can't breathe, right, time to wash it, okay? So anyway, those were the 3 reasons why they told us don't wear masks. But then they found out even a cloth mask is so effective. At first they said, the cloth mask protects if I'm wearing the mask, Jason, and you're not, it protects you from me, whatever it was, 90%. But then we've realized it protects me from you. If I'm wearing the mask and you're not, another 65%. So the protection really is 2 ways. Then the CDC was pushing masks almost to the point of, making it mandated. But, they kind of got caught in their little misunderstanding. The feds, they went, now that we know how mask is good, instead of saying, now we know mask is good, they went and said the 2 reasons they spoke against it was that you keep touching your face, and you detract from the healthcare workers. That's half the truth. The real truth that they said it didn't work and gave a false sense of security. Well, we know they work now. They should just admit it. Okay.
And let's start by our environment here. If we wear masks and we change them every day or
Yeah.
every time we're in a new environment, that's plenty. We get a package in the mail. What do we do with the package? Leave it outside? Leave it inside? What do we do with?
Truthfully, if the package was inter-island, I don't care. That's ambient temperature and humidity in Hawaii. If you think the package came from a cold climate, hey, let the thing sit there for 5 hours, then open it.
I see. It's that simple. I mean, that's a really strong. How do you get these feelings? And is that you've done testing? I know you're out there trying to get to figure out what to do here. What's up?
There were studies which showed that this virus and other coronaviruses, they actually do, as the temperature starts to increase and the humidity, they disappear. They're not viable. They're gone. But the break point is right on air-conditioned temperatures. So if you go in Hawaii and turn on your air conditioner, I can't vouch for how quickly the virus disappears on the surfaces, you know? So when we had the outbreak in the nursing home, first thing I did was turn off everyone's air conditioner, open up the window. Ventilation is an added benefit. And all the workers in PPE, they said, oh God, this is hot. But all the residents said, oh, finally it's not so cold. Old people don't like to be cold, okay? But really, ventilation and our ambient temperature and humidity is one of the things really that get us going here. I mean,
I just want to keep going back to, and when you're out, wear a mask for yourself and for others. Wear a mask. Yes.
Well, yeah, no, depends where you're going out. If you're going out to the wide open spaces where you're going to be, I say 10 feet, people say 6 feet, I say 10 feet. You got the ventilation, you're in Hawaii, you're way out there, it's wide open space. Technically, you don't really have to wear a mask, but they want you to have one, because when you go back to the parking lot after walking around the beach, and somebody says, can you help me with my tire? Yeah. Then all these people gather around fixing the guy's tire. Just have one with you when you go out. Now, this came to a head like 3 months ago. My daughter and wife were walking, Keapolani, exercising, walking. And they kept encountering people on the oncoming path. And they kept stepping off the path to keep that 10 feet. And finally, there was so many people, and they were walking at night. So there's a very good question. They said, we keep encountering people, and I know I'm in their breathing zone. So I asked my daughter, well, how do you know that? She said, I can smell them. I mean, the perfume on the women, the men you can smell, they're huffing and puffing. So, here they come. I put on the mask. Oh, take them off then. Oh, here comes another guy. Put them on. So I said, well, how many times do you put the mask off and on? They said 3 times in about an hour. Now, that was one of the other rules, right? You can't keep putting the mask off and on. So I said, look, if you're going to do it that much, keep the mask on. Oh, but then I can't breathe. Well, go walk somewhere there's not so many people. Well, okay. Or get off a little bit on the paved pathway. Yeah, there's grass. Can't you walk on the grass? Oh, okay. I mean, so the 3 things mask, right? If you're going to put it off and on, that's like, ew, it's going to get into your eyes sooner or later.
How do you stop? Let's say now someone gets it. I have to go get tested to be able to see if I was somewhere near them. I should get tested.
Okay. First of all, Maui is pushing, and we adopted a pilot project.
Yeah.
An app, right? So we all got to use that app. If we all use the app, and I was a case, and I reported to Department of Health, Department of Health would ask me to put it up on the app to say, I'm a case. It doesn't name me. It says like my cell phone is sitting next to a case, me. If you're on the app, it will ping you. You've been exposed, if it's whatever, 6 feet for 15 minutes or whatever. So first of all, it's out of nowhere. It says you've been exposed to a known case, Jason. It won't tell you who, and it won't tell you when. Because if it tells you who and when, you might deduce it's me, and that's privacy. But it's going to start pinging people on known cases. That's number one.
I haven't had it ping, but I have the program going on.
Oh, yeah, I got the program too. But more of us have to. Well,
Something happens, I hear it.
first of all, two things. That person, the case got to be confirmed by the DOH. Yeah, that's how we do contact tracing, right? And then
Is that the name important? Aloha Safe Alert.
yeah. There's two, but we all got to kind of get on it. I mean, if only half of us on it, then it's half, but better than nothing, right? Okay, so you're going to be pinged, but the case has to be willing to put it on. The Department of Health doesn't put it on. There's privacy issues. Like, okay, I'm telling people I'm the case. It doesn't name me. And you can't possibly deduce it's me because you don't know where it was. It doesn't say, well, the guy who walked in your living room. It's like, Jason, in the last day, you came in close contact with a case. Now you have to decide, well, what do we do? You can call us. You're going to watch yourself. You should kind of stay away from people. But if you get sick or you're really nervous, like, well, I got a big banquet in 5 days. I'm going to visit my parents. Go ahead, get tested. The mayor put on free testing at 3 sites, in Maui. We had that for a while. So we have free testing if you want to go. You want to stay away from people, if you should. If you get sick and you were pinged, I'm going to say, hey, Jason, now that you're sick, maybe you could get tested. Why? Because that's one of the markers for really having COVID, being sick. Yeah. Now, half the guys aren't sick, but come on, if you're sick, you're probably COVID. Now you really know, stay away from people. And then if we test you, you become a case. Jason, can you ping the other people who contacted you? It's, electronically, right? So I saw my phone. I haven't been pinged yet. But because our case numbers are kind of low in Maui, so people don't forget about it, I asked, oh, crap, that's what I forgot to do. I got to call back the guys who do this, Aloha Safe, and we're going to put out not a fake notice, but normally you'd be notified for cases. This is just a test to remind you.
Get them to enroll.
Oh, God, I'm glad we had the call. I don't remember to do that. They have a little script to send out. Now, Colorado has this, but it was so useful for notifying people. They started notifying people for other things. And then it comes like a catch-all notification. No, we just want to keep it for contact. Oh, gosh, I got to do that. Thank you, Jason. Hey.
You're welcome.
Okay.
So here you are. What about people that suddenly they're sick?
Okay.
Stay in place rather than go to the hospital.
Okay. Now, you remember, well, maybe you didn't remember, but for controlling COVID, we had those 6 W's. The feds had 3 W's. Wash your hands, watch your distance, wear a mask. Maui stuck on 3 more. Wipe off the surfaces and disinfect them that are frequently touched. When you go out, head for the wide open spaces, no flotillas. And the final one is wellness. Don't go out if you're not perfectly well.
What about keeping well and doing the things that make you well, right?
Well, yeah, that's fine. You got the nutrition, you got the exercise and all that stuff.
That's the next question about vaccines, right?
Okay, but for keeping well, COVID kind of affects like everybody. So it's those 6 W's. Now, if you don't go, if you're not perfectly well, don't go out. Don't go out and see people, right? Now, my daughter, I just always take my daughters. Like, well, Dad, I wasn't perfectly well yesterday, so I stayed away from people. Thank you. But I'm better today. No. If it was COVID, and since you didn't get tested, if it was COVID, I think you're shedding for about 10 days, even after you get better. Oh, so what do? How do I go, like, hiking? Like, are you going by yourself or somebody from your household? Whatever you do, contact people. Make sure it's way outdoors. It's almost like being by yourself. Now, if you say, well, I can't hike by myself. I can't go to the beach by myself. Well, okay, maybe you shouldn't go to the beach. But you can do it with anybody else in your household. Like if your boyfriend's living with her, okay, the 2 of you go to the beach. You're both equally whatever. Your fate is the same. You share the same fate. So 2 of you go away, go hiking. Make sure we don't see you. Well, stay away 10 feet from people.
They become your family, share the same fate. You drive in the same car, you share the same fate, right?
Yep.
Okay. I looked and I see 19 numbers. 19 yesterday, and that was the highest I ever saw. Am I right?
Uh, yeah,
After
but
Thanksgiving, pre-Christmas, travelers. What do you think?
okay. All right. First of all, there's like two counts. One is by the official one by the state 2 days later, 1.5 days later, and we run a count early. Every morning they give me a count. They're not really they're not we really suspect those, but they have to be confirmed and entered into the state system. State system's called Maven. Fine. Why do we jump the gun for a day and a half earlier? Because we got to do the contact tracing, man. We got to get on these. So I have, and I report to the mayor, the early count and then the later count. Okay. Sometimes the numbers don't exactly line up because sometimes we jump the gun and they turned out to be from another place, not Maui. Sometimes it was a double count, like you counted the guy twice, but that's okay. We're conservative. It's not way off, okay? So when you see 19, well, you were talking about yesterday? I saw 25, okay? No, on the early count, and we moved on to 25. But look, no matter how erroneous or glitched your counts are, you can follow them for trends. So if you take the later count, okay, just follow it. It went from 12 to 11 to 19 and all. But I'm following the earlier count. And the earlier counts, a week or so ago was like 24, 23, 25. Then the early counts went down to 11, 17. And to me, the earlier count today is 19. It happens by dumb luck to match with your number of 19 of the later count. Whatever. I'm used to the mid-20s, okay? Now, I was told, be very careful, Dr. Pang. There's some early counts that are going to approach 29. Okay. Now, while you guys talk about 19, I'm talking about 29. It doesn't really matter. You're following a trend, right? Okay, so we all follow the same trend. It's going up. Okay, we're worried, right? I hope so.
I hope so.
So the first thing is to ask, well, are you testing more? Okay, absolutely. The more you test, the more you're going to find. That's what Trump said, and that's partially true. Yes, we are testing more. We're so much testing that the agencies that test, the big testing sites, there were 3 of them, they're short of supplies, and they're asking me for supplies. And we have. I don't sell it to them. I mean, I give it to them, but they can't charge for it. But we didn't hoard. But 4 months ago, we thought we would run out of some of the kits, so we got them, and we give them to them at no charge, and they don't charge the public for them. Okay.
Kula Hospital
Testing.
twice a week. There are 3
Second.
times. I have a friend at Kula Hospital who's getting 12. Monday they test, Thursday they test. They're trying
Yeah.
to get it.
That's called interval testing
Okay.
because those are high transmission targets, yeah, high consequences. So they test. The general public, I'm not going to say, oh, let's all test. It's free. You can test once a week. You can test once a day if you want, but we're going to run out of tests. So first of all, you see a high number because we are testing more, yeah? And if you look at the positivity rate, I talked to the mayor about this, it's not really going up yet, but just because of that, we discussed, well, who are your cases, Dr. Pang? Is it the visitors? Not anymore. It was initially when the counts were, say, your count was 11 or 8. There were always 3 or 4 visitors. And for a while, when it was several a day, there was 5 or 6 visitors. Then it went to the residents. So who are these people, the 19? I would say about 15 of them are contacts of cases. They're not out of the blue. 4 of them are out of the blue. Like, who's that? That's new. Those are surprises. That's the ones you worry about. I call it salt and pepper. The others are contact of cases. Now, the mayor says, okay, well, what kind of contact? You saw what happened in Lanai, right? There were cases seeding into the families. But when we checked them again, it was all contacts, family contacts. Stay in your house. Your house is already cast the same fate, but just everyone stay in your house. Of course, the numbers will go up because the household contacts would start to get sick and we diagnose them. But on Maui now, our contacts of cases, let's say there's like 15 of them by your count. Okay.
My
Contacts
count
of
is
cases.
Maui now. I look at Maui now in the afternoon.
Okay,
So,
that's fine.
right.
Happens to be your count coincides with my count today by dumb luck, 19. Okay. Okay. But the contacts of cases are not just households. I say it's mixed, almost like a third are households. Yeah, you control the household and that goes away without spreading, right? Some of them are the workers, like restaurants. And so when too many workers get infected, you got to close the restaurant. They can't work anyway. Some were bars, yeah. And then a third were gatherings, not the massive flotillas, not these massive funerals, just 2 on 3, small gatherings, trying to get together. And so that one, the equal, third. And truthfully, the areas that seem these cases are coming out of it is South Maui and West Maui. And if you say, well, what's with South Maui and West Maui? Try ask the travelers who come in, where they go, South Maui and West Maui. Are we seeing a lot of contacts in Kahulu and Wailuku or cases? Not that many. But it's not, there's one more point that we are seeing some cases come in. Haiku, yeah? Haiku. But really, a lot of it is South Maui, West Maui. At first, the contacts, like a week ago, were really associated with bars and bar hopping and the patrons of bars, not the staff yet. But then when we started looking in the staff of bars and the restaurants with the bar, yeah, there were some infected staff members too. So
gymnasiums or no?
There was a gym. There was a gymnasium, and I didn't know what it was, but they said it was spin class. I guess that's
a little confined area stuff, not the big open spaces.
Correct. And I was just wondering, okay, you want to be fit. I want you to be fit. So when you get COVID, you can withstand it. But first of all, can you kind of go outside and do it? So I asked them, the spin class, I think it's like a stationary bicycle or something. Can you put that outside? No, it's going to get wrecked by the rain. Fine. Can you just walk? Can you just walk fast? Can you go outside? If people say, well, no, my sport is spin class. Well, can you make a change a little bit until the vaccine comes out? I mean, that's all I'm asking. And it's kind of odd in Hawaii when it's possible to walk outside without slipping on the ice and putting on 5 jackets. You don't do that. I mean, why wouldn't you do that? I don't know. Maybe they don't like the sun. Fine. I have trouble with the sun. So when I spearfish, I go at night. Can you walk in the evening and in the morning?
But no matter where you go, if you keep your distance and you do the right things, the W's, you're good. You try, right?
Yeah. But you know that thing, the distance, 6 feet, I like 10 feet. If you're going to huff and puff in spin class and it's enclosed, oh man, you might as well just say 20 feet. If you're in a bar, enclosed, even not enclosed, and the TV is on real loud and the background music is on loud, and I'm shouting to you over the other guy shouting, I don't care if you're 20 feet. Yeah, I mean, it just defeats the purpose. So we know singing, shouting, huffing and puffing really, really moves the germ on the exhalation.
But 5 or 6 hours and it's over anyway.
Well, that's on a surface. If I spray my germs all over the place, I think, well, hopefully it's not air conditioned. Of course, some of the gyms are, aren't they? You huff and puff, then they're air conditioned, and the germs that went on your machine, gee, I guess it could be there 1 to 3 days. Well, we wiped it down. Really? All the surfaces that are always touched? And did you wipe it down between all the patrons? Or I don't know.
So the patrons can protect themselves with gloves or something. They could.
For the surfaces, but for the breathing, holy cow, I mean, huffing and puffing with or without mask, man, I mean, wow, you may as well just.
Well, I think the difference between a closed gymnasium like an Anytime Fitness small space,
Correct,
and a Planet Fitness, which is a big open space, the social distancing between machines,
the ventilation and the ambient
story.
Correct. See, I don't know these places, so I don't know when you say Planet Fitness or whatever.
Okay.
I don't know.
Yeah. But
I don't know the bars either.
people are starting to get afraid that I see. And a lot of people say, we're moving off island because the airlines are going to say we can't get on an airline without vaccination. So we're already planning on selling our place. What do you hear about that stuff?
Okay. The commercial settings, like a store, in airlines, DMV, Division Motorworks, it's their place. They can tell you, you don't want to wear a mask, you don't come in. Okay. All right. So the airlines can say that right now, Jason, you don't come on my plane unless you wear a mask. The vaccines are not quite there yet. They're still in experimental, but once the FDA gives them non-experimental approval, probably 6 or 7 months from now, minimum, then these agencies have the right to tell people you don't get a vaccine, you don't come in. Okay, it's their right. Now, that might dissuade a lot of people from giving the business, but okay.
What about people that won't take vaccines? Staying healthy? And there's alternative ways that people have devised to, I don't want to say be the vaccine, but stay healthy and be not in the line of whatever this is. It's
Okay.
more technical than I understand. But.
If you don't take the vaccine, you got two choices here. You can try not to get infected, or if you say, well, I think I might get infected here. I'm glad some of you took the vaccine, but I'm afraid of side effects. So if you do get infected, you're going to try to survive, right? Now, it turns out that they looked at all the risk factors, even in the old people. Now, old people don't do well, right? Not all the old people, but they don't do well. And they said, maybe it's all those risk factors in the old people, hypertension, diabetes, low immune. And after they removed all these other factors, they were still left with just the fact that you're old. So what they're trying to tell you is just the fact that you're old. Healthy old people, they still have a higher risk. Now, not as bad as unhealthy old people, but still have a higher risk. So if you're going to try to wing it, don't take the vaccine. You're either going to dodge infection or hope you can survive it.
All right. That's a good plan. And
now, if you do get infected, then congratulations. Maybe you got a natural vaccine. You got infected, right? But it's still kind of controversial how long the protection lasts after the vaccine and after a natural infection. Okay.
Well, there are a lot of people that won't take vaccines. So
yeah,
that's one category. More and more. I mean, I keep seeing stories, people that I wasn't thinking would even be that way are also anti-vaccine. But you're saying after you get an approval of non-scientific, non-experimental,
yes,
when the true test will come of whether you take it or not.
Correct, because they will start telling you, you need proof of vaccine before you come in here.
Okay. So that's pretty much our timeline, right? I guess.
Yeah. I wonder what the airlines are going to do. And that 7 months is minimum. I mean, I'm pretty sure we're not going to have something before. Now, it might take 2 years, but I don't think they can regulate this for sure before 7 months.
We heard that Qantas did it, and they're from Australia, maybe.
Yes, but that's kind of interesting because, well, if they make people get the vaccine for coming on, especially their own flight crew, and there's midterm side effects 5 or 6 months later, yikes, people are going to say, what have you done? You know, the military ran into problems like that before, yeah? They mandated the smallpox vaccine, the new one, yeah? And after a while, I think 9 or 12 months, they looked and they said, holy cow, the side effects on your heart, pericarditis. So it's kind of like, whoa. So they stopped it. They stopped it. Right. So it's not like a slam dunk here.
What are you forecasting right now for the short term and then the longer term? I mean, here we have Christmas coming up imminently, and then, you know, that we're going into a 2021. What do you foresee for Maui and our tourism plan? What do you see going on?
Okay, first of all, there is one school of thought, just protect with the vaccine the people who are highest risk. So highest risk will be the elderly, yeah? And highest risk of transmitting to the elderly are the healthcare workers. So we're going to race around and try to protect at least that group, probably by, they call it like Super Bowl. Now, I don't know what date is Super Bowl. What is that, February 3rd or something? So a lot of people said,
January, but okay. And
like,
again, there's lots of
February.
resistance. How much resistance? Say a third no vaccine. That means a third of them are there. Potentially, how many people are not going to take it, you think?
I'm surprised. It seems to be about half. Wow. And that's on first pass. But after we get it going, and then you find out, like, I took the vaccine, but you didn't. How am I? I'm okay. Then they might change their mind. So at any time, this half that didn't take the vaccine could say, okay, we want it. Now, I'm sorry, but I was planning on the next group. So they get to always cut in line as they change their mind. I was surprised, though. Half said they're not going to get it, not yet. Okay. Now, that's the workers who work with healthcare and elderly, even elderly. Now, the elderly might want it. Okay. Because look, Jason, it's kind of like altruistic. The staff that work in a nursing home, they're trying not to give it to the elderly guy, but they themselves might weather an infection okay. So it's altruistic, right, that they got it to protect the elderly guy. The elderly guys might get it, maybe like 90%, because they have direct benefit, okay? So a lot of this is protecting the ones most vulnerable, and then the rest of us kind of like weather it through.
You've heard the stories that the vaccine only helps one type of COVID, that it's changing and mutating so constantly. You hear that stuff, or?
Yes. Now that's probably true, because they chose a target which is called conserved. That means all COVID has been mutating, but that target they chose, the spike and the spike protein, that seems to be common, conserved amongst all of them, right? I mean, it seems to be conserved. So at least they chose a common, so far, target, even though the other parts are mutating. But if they ever have mutations on that spike protein, whoa, time for a new target. Okay, now, the concept of the mRNA vaccine, this is a new kind of vaccine, easy to make. It's easy enough, really, Jason, just to switch to the new target that you want. So you got the concept, you got people, we got enough experience with the safety of an RNA vaccine. So if it does mutate, well, go pick the new spike protein. It shouldn't be that hard, okay?
Have you, I don't know if we've ever talked about it. You ever look at HHO, hydrogen, they found in China? Maybe you've seen the video or not, of patients that were on ventilators and they switched them to HHO breathing gas, and it stopped the inflammation in their lungs, and they were getting better and better and better. Have you seen that?
Wait, what's HHO? That you mean H2O? That's water. Did you mean
Electrolyze?
H2O?
If you electrolyze water,
okay,
you create HHO, which is water, but slightly modified. There's a guy that on my website does an explanation chemically of why it works. I know, Tyler Laverne from the Hydrogen Institute. See, you see those machines behind me? There's a guy on Maui making machines for this HHO, and then suddenly COVID broke out. People that use it are getting great. I think I touched it, but it was way before it was time.
Okay. I would rather take a known drug off the shelf that's known to be safe and see if it protects COVID. They're pulling one already, quite a safe drug, quite cheap, ivermectin. It's been used in the third world for worms and stuff like that. Strange. It's also used, I think, well, never mind that. There are other drugs that we are known to be safe. So I'd rather take a known safe drug and see if it affects COVID. They tried to do that with chloroquine, right? Chloroquine.
Well, this is something, that's why I said hydrogen is not specifically because of COVID and safe and everything else, but it's been found effective to bring down inflammation in the lungs, which I thought was really critical.
But you have to show me that it's safe.
Oh, yeah.
It's widely used. I mean, you guys showed me in animal models, and sometimes
It's
you
all
give it,
over here. It's in the United States and all over the world now.
okay,
But
sometimes you might give it to the wrong time in a COVID. Some guys who are sick, they don't have enough immunity. Some guys have too much immunity. I mean, they're both sick, and you could try to figure
yeah.
out which is which, right?
Well, maybe a different subject because hydrogen is yeah. But the reason I was bringing it up is I haven't heard anyone talking about natural preventative things and things that are good on a general basis for people to improve their condition so that when they get it, can you have COVID and not get sick? Sort of, yes. Can you not pass it? Or you do pass it if it's in your.
I don't know. We don't know about that. There's a lot of guys who don't get sick, like a lot of kids, but they can pass it. I mean, that's why we have COVID. The easy ones have been solved. So of course, yeah, the kids can pass it.
I see. What do you think is the most important? What do you think is the most important thing for people to know right now? Because there's a lot of question about, like I say, what's going on with Hawaii? Tourism, you think, is going to keep on keeping on? Are we going to keep on increasing safely, as safe as can be?
Your question in Hawaii is if we open the economy, like Oahu and Maui have tourism, yeah? We open the flights. Can we operate at that higher level and not rise? I think that now when people say, well, Maui's in the double digits, that's not real helpful. 11 is a double digit, and so is 99. It would be nice if we held at the mid-20s. Okay. Yes, it would be nice if you had 5 a day, 3 a day. But the question is, can you hold it at the mid-20s? Why? Can't we just drive it down to 5? Because you open the economy. Yeah, because you allow flights to come in. And these are the seeding cases that jump into your community. Why? I didn't see that. I would say for every case you know about, there's maybe 4 or 5 you don't that jump into the economy. Why do you think you didn't know about it? You think a tourist is going to say, hey, check me, man, I might have COVID.
Why isn't there a second
If
test
he
when I
does,
get here? Well, I mean, I was
because that'll deter tourism, according to the business guys, right? A mandatory second test, quarantine till the second test. Now you get a second test. How long were you planning to stay here, Jason? A week? No. Surprise to you, you're positive. You're here 10 days. And we will ground it so the flight won't fly you. And everybody you contact, the rest of your group, if they're negative right now, they're here for 14 days. If they turn positive.
What about taking
if they turn?
What if you turned it to 4 days? You know, Josh Green was talking. The question of how do you eliminate those things that get through? What's the answer there?
You can't. It's as simple as that. With a single pre-travel test, the longer before you come here, yeah, the less effective it is. I mean, why didn't you get a pre-travel test 2 months before? Oh, because you got all this infection since then. So in general, the longer before. Well, why did they push it back? Because they couldn't get the result in 3 days. Because the labs are busy on the mainland. They got so much COVID. So why don't we push it to get a test 1 day before you come? Nobody can turn it around that quickly.
And they're also you're doing temperature when they arrive, even though they've been tested.
Too many asymptomatics coming in, and too many guys with the temperature fluctuate. Look, if it was easy, we wouldn't even be having this discussion, right? We would have solved it, right?
Welcome but it's worth talking about for the public, is why I bring it up.
Yes.
You know? I like to think that most people ask these stupid questions. They're not stupid. But yeah.
Forget the cost and that administration. What is ideal? If God said, Jason, what do you want? Ideal would be periodic tests every 2 days, every 1 day if you want. And it moves. I don't care where you travel, when you travel, you keep getting repeat tests. How's that? In fact, that was one of the proposals. Yeah, the saliva test, Oceanet. We get a saliva test every morning, cheap, easy. It's quick read. Well, not that quick to read. And every morning, if you're negative, go out, have a good time. It's like a daily thing. Because every hour you could change. If I test you now and you're truly negative, hey, in an hour you might be positive because incubation it grew in you.
And if you're quarantined in 10 days, you're over. I mean, I'm
Oh,
talking 14, but I'm thinking
yeah.
if you get it and you think about the extended trip, you talked about staying here 10 days. Is that because you figure in 10 days you're not able to transmit it and you're sick about it on a plane? Or if you're sick about 10 days and can't, what is that for everybody to know that's got it? I think that's important to understand because we don't know. Why is it so important to not know who's got it? Because of the stigma. I'm trying to figure out how to isolate this thing, separate it so it goes away. Don't we have to know?
Okay, wait, you asked two questions at once.
Okay.
Why do we not name the person? And then you asked about reducing from a 14 to a 10-day quarantine.
No, I was thinking the not naming is because of the stigma.
Correct.
Okay.
Correct.
But the 14-day, when you were talking about if someone was planning on staying 3 days and they take that second test, and now instead of staying 7 days, they'd have to stay 10 days.
10 days. If you're infected, you're infectious for 10 days. If you're inoculated but not yet sick, we gotta wait. I mean, once you become positive, or put it this way, once you become positive, sick or not, you're probably infectious for 10 days. So I detected you as positive, okay? Now you gotta go away from us for 10 days. But all the people traveling with you, they're not positive yet. So how long do we have to wait for them to present as positive? 14 days. But they're not even positive. Well, too bad. They got stuck here 14 days. And if they're positive, turn positive on day 13, Jason, and I said, see, I told you he turned positive on day 13. I was right. Once he turns positive, then he's stuck here another 10 days.
What do we do with those people?
Yeah, good question. What do we do with them? We block the flight so they don't fly back. CDC blocks them. Oh, let's see. Can you find a place to stay? The hotel is supposed to take them, but they weren't planning to pay that much. And they got to get back to start or whatever, take care of the kids. So you kind of screwed up their vacation, right? Right?
Of course.
Okay. So if you have a mandatory second test, who's going to come here knowing you can do that to them if it's positive? That's why Big Island with a mandatory second test, that's a whole different kind of people who go to Big Island. If returning residents say, man, if I have to stay here like 25 days, I can handle that. I'm a returning resident. But a visitor, so the visitor industry says that kind of stuff shuts down the visitors. Okay.
Wow. Well, what about hotels planning long-term visitors until after this?
Okay. Let's say they even have the room and the setup for them. Who pays for that? When all of a sudden there's somebody who has to stay here extra, whatever, 10 days. Who's going to pay for that? The visitor or the hotel? Or is it 50-50?
Well, you hear them talking about having a deep pocket, long-time traveler that would solve and you'd eliminate a lot of people. There's no choice.
Well, at first, the hotels weren't stepping up. I have to admit, a couple of hotels on Maui really stepped up. They didn't take, not only did they take their own positive guys, they took positive guys from other hotels. But them and us, if you flood our sites and we can't take any more people, isolation once they're positive, quarantine once they're exposed, then what are we going to do? Well, the visitor industry said, not our problem, Dr. Pang, it's yours. Okay, well, how much is this worth to you? When the visitors don't come because they can't get home, not only that, but we don't have a place for them. So how much is it worth? You want to open the economy to visitors, like we got to take these cases. If you're not going to, can you help us cover the visitors because you wanted the visitor industry open? Everybody's got to have skin in the game here, including the visitor.
And how they feel. They have to.
Well, now they are. The mayor kind of yelled at people because our sites were getting loaded. And the poor hotel who said, we'll take them all, any other hotel. Oh, he was getting loaded too. And like, wow. So where are you going to take all these people who come in positive? Or the not just that, but hey, check this out, Jason, to make it even worse. A family comes in, that did the right thing. They're all negative 3 days before coming. They had a good time. But then there was somebody who came in and their result was pending. Or suppose his result's positive, right? Okay, you got to stay 10 days. And all the people who you exposed got to stay 14. You know what? They pulled the seating plan on the plane and they found this family who did the right thing, but they happened to sit next to somebody who turned positive. And that family was stuck here for 14 days. They did the right thing, man. They were all negative or having a good time. You sat next to like some positive guy. So didn't the airline said they would space them out? Well, I guess maybe they wanted to say that, but maybe they didn't. I don't know. But there's one airline that really does space them out. And so that if you're positive, well, who sat next to you? Nobody. Okay. There are other airlines who sat next to you. Well, look, there's 5 guys. Call them up. Tell them they're exposed. I'm sorry, but they did the right thing. But they were exposed to the guy next to them. They're here 14 days.
Well, what are we going to do about that? I mean, I know it's not your problem. It's everybody's problem.
You really want to know what we're going to do about it, right?
Yeah.
So they called me up and said, hey, that was no fault of their own. Half of my staff said, well, they should have known. I said, really? They should have known that if they sat next to a guy and they did the right thing and now we ground them for 14 days, the whole family, 7 of them, right? So I thought, and we got the clearance of people that to sweeten their time here, because now they're here for 14 days, right? CDC blocked the return flight. So I said, look, I tell you what, I'm going to test you every other day. I could test you every day, but I'll test you every other day, you guys. And then as long as you're negative, you can at least stay in Maui for 14 days and enjoy Maui. How's that? My father was mad as heck. But then he says, okay, I get it. I see you're trying to make some compromise. Okay. We go down there. We test them like every other day, right? And they get to enjoy Maui, right? Okay. The first time we test them, there was the guy who sat next to the other guys was positive. Then we thought, oh shit, your whole family, like 7, you all share the same fate. Now the father goes, holy crap, thanks for testing. That's why you have these rules. Try to test these other 3, because we tested and it was a rapid read. There were like 3 out of 4 positives, okay? So the father went from being angry to so thankful. Thank you for finding this. So this thing really does make sense. Yes, you sat next to a case, affected your family because of the rules, and I was trying to give you a break. You're all infected.
Did the hotel pick it up?
Well, the hotel was the one. I mean, it's real complicated. The hotel says, oh, crap, now we got to do this. I don't care. I think the mayor picked it up. The father said he would help pick it up. He was thankful we diagnosed him. But Jason, let's put a little sting in this. Not so easy, yeah? The family turned positive. All of you guys, you're stuck here now 10 days, okay? Before it was 14 days because you were exposed. But now that you're positive, 10 days, right? Except for the boy. The boy was negative. So the mom says, because of the boy, we have to stay here 14 days in case he incubates. And I said, it's even worse. If he's positive on day 13, I'll stick another 10 days for a positive case. So the mom says, well, what do we do? What do we do? The hotel says, we separate the boy right now. So he cannot be positive 13 days. But the boy said, I'm staying with mom. The mom says, he's staying with me. Fine. If you infect the boy on day 13, I add another 10 days. Okay. So the father goes, Dr. Pang, first of all, thank you for helping with the family. Like, what the hell? I mean, so we stay extra time in Maui. What's the problem? And besides, my kids already, after 10 days, they're immune, right? And he kind of put this in perspective. Sharp guy, not a medical guy, San Francisco software guy. He goes, well, I know, Dr. Pang, in your career, you've had to tell people worse things, like you have malignant melanoma. He says, all you have to do is say, we're going to ground you in Maui for 14 days.
What if they're living in a vacation rental and they have this problem. What do you do with them then where there's no?
Okay, you remember that hotel who's willing to take all from the other ones? That hotel is taking that kind of problem, right? Being kicked out and taking it. It's a nice hotel. I'm not allowed to name them. No, no, but some hotels are stepping up to take guys being kicked out from other places, right?
Wow.
And then sometimes if there's no room to go, we put them in our quarantine site, isolation site, and I go check on those people. And you know, it's like near the airport, there's an old parking lot surrounded by a fence, and I tell them walk a perimeter 4 times in the morning, 4 times in the evening. You need exercise because you guys going to get COVID. And you know what they say? Hey man, from 10 o'clock to 3 o'clock, it's hell. It's hot down here. Yeah, it's like the airport on asphalt. But you know, they said, you're absolutely right. We come out, we get that chair, space ourselves out. Twilight in Hawaii. We saw a side of Hawaii we never saw before. Just sit outside quietly at twilight at dawn. And I told them, get out at twilight at dawn and walk around the perimeter. Kind of big place, 4 times. Otherwise, when your COVID shows up as symptoms, you're going to have a tough time.
Now, here's another fun question. That was a
Sure.
question. We got a whole season here. What do you think's going to happen? Oahu's getting. It's hard to control this thing. We're talking about controlling Maui, and maybe you're doing an excellent job. This thing is getting out of control, and we're losing space and running out of space. What do you figure we can do to be our best case scenario? Or
Okay. We see the numbers going up. Yeah. The trend. Yeah. We also see that the positivity rate is not so high because we're doing more testing. I get it. Nonetheless, maybe the numbers are going up. So the next question is, who is going up? You remember Lanai? Wow. Lanai, the numbers really went up quickly. But we knew we could control it because all the contacts was family members. So everybody stay in your own house. And it did not go from the Pacific Islanders, their families, to outside, maybe one or two. So that's the first question. Who is going up? And when it's mixed, some are family, some are little small gatherings, not big flotillas. They seem to get the message. And then some is like occupational. So we are just going to try to preach the 6 W's again and see if that can control it. Otherwise, we have to start to slow down the economy. Instead of stay at home, I don't know, safer at home, the rules. Hey, but, some of these rules, at least in Hawaii, safe at home, stay at home, I always want them to go outdoors, kind of by themselves, right? And if you say, wait, I gave a stay at home order. So the mayor and I talked about this. Can we let them go out? Now take a mask, because in the parking lot and helping the guy fix his flat tire and all that crap, you're going to get COVID in your face. But can we please on Maui get out? Psychological, physical activity, a little bit each day and no COVID. And really, isn't that what you came to Hawaii for? The outdoors. I mean, really, did we come to Hawaii to whoop it up in bars? Well, I didn't. But if you need that, I'm asking you to change your behavior. And I hate to say this, man, but did we come to, in Hawaii, can we not do indoor gymnasium, indoor exercises for a while until this is controlled? Hey, I do physical activity. I could do Tai Chi indoors. I could do Tai Chi outdoors. Ours is outdoors. Oh, it's so hot. Try in the evening when you're supposed to do Tai Chi. Oh, it might rain. Really?
skip a day. Right.
Or just step under the lanai. In fact, that's what we do, right? Okay, so, but I didn't do this for COVID. I was just doing this, okay? Because I don't like indoor activities.
Well, I want to make sure that I mention this girl's name because she was terrific. Cassandra in Tennessee. She was in Tennessee, and when she heard I was in Maui and she helped me, she said, wear a mask. I think that's still, you think those people on the mainland are headed to any kind of sanity like you're posing? You think, how are they going to do it? How are they going to stop it?
Okay. First of all, the mainland in the winter it's depressing. Okay. I really need to get out. So even when I was in college on the mainland, med school, I got out. Rain or shine, cold or not. And I was in New Jersey, then down in New Orleans, but that's not really kind of like the mainland. Okay, then San Francisco, then Washington, D.C. I have to get out. I think the folks on the mainland should get out. Put on it, I mean, for your own sanity. Plus, you get to exercise and breathe heavily. If you say, I got to exercise, fine. Can you do it outside, not in the basement with Junior here? So really, oh, then we lived in Europe. Yeah, that was cold and dark. I got out.
Okay. So do you think we're going to wrestle this thing down to whatever in 2021, or am I just fooling myself?
That would be interesting. If we vaccinate all the older people and all the susceptible people, and then try to keep it from them by vaccinating all the people who get close to them, the medical guys, the nursing home guys, we still might have COVID cooking in our community, yeah? And why is that? Let me try to explain this, because people keep coming up with this and saying, well, that doesn't make sense. Look, Jason, if we have 20 people, let's say our community is 20 people, right? And I said, hey, you guys, you got to do that 6 W's. And we all do it. Then you kind of wipe it out and it's gone, right? Yeah. But if you got 20 people and COVID's in there and half the guys do it, ooh, and half the guys don't do it, okay, then these guys mask up and you think it's gone. So we stop wearing masks, but these guys never eradicated it and they give it to this guy. Okay, so now one guy out of the 10, because it's 10-10, got it, okay. But these guys didn't quite do it. They stopped masking and they're still susceptible. So he gives it to him and he gives it to him. He gives it to him and just ping pongs back and forth. I think that's our community.
So is that the American way? Are we?
Yes, because we are so independent. We can't do everything all at once. And it's ping ponging. And I put that, we shut down that community, like Lanai, okay? Lanai, they did it, they got rid of it. But it's going to come back because they didn't all get it. They're not all going to get vaccinated. They'll come back to Lanai, right? Let's just take Lanai and Hana. Let's just say Lanai and Hana, right? They travel back and forth. Then they give it some to Hana. Hana masked up, but they didn't completely wipe it out. There's some guys in there. Then they gave it to Lanai. Kids could ping pong back forever. Even that family I told you, Junior, who couldn't get away from mom, gee, he's positive on day 13. Well, who's he going to give it to? Thank God the entire family was positive, so they're kind of immune. But you get it, right? This thing could, what do you call that? Round robin, just musical chairs in our community.
So it may become part of future life, and everything's going to be 6 feet for the next decade until herd immunity happens in 2027.
Maybe not though, because if you protect all the susceptible people, if they have herd immunity and stay in their little nursing homes and all that, then who cares what happens? Except, the rest of the community ping-ponging and never quite doing it. Let's go visit grandma. I don't think so. Even little grandma, the joy of my life is to see my grandchild. I don't think so, because you haven't eradicated it. But wait a minute, you vaccinated grandma. Okay, then go, grandma, have a good time. So you see how it is. If you can vaccinate the susceptibles and it's ping-ponging around the community, so what?
Well, because of the heavy, I know people that are so determined, that are older, determined not to take the vaccines. Seriously, large groups, including all kinds of, professionals, every kind of people. So what do we do?
Well, we give it to the ones who want it. We let a short supply. And after a while, we start to publish the side effects, and the benefits. Then maybe the guys who are reluctant at first will say, I want it. But maybe a little kid will say, I want it. I said, no. This is for grandpa who just changed his mind. Oh, by the way, as it goes in the community, ping-ponging forever, it's not exactly benign, is it? Look at the publications out of Korea. Out of the people who got COVID, the normal people, not the old guys, right? 25% continued to shed the virus for longer than 3 months, maybe 5 months or 6 months. The virus wasn't dead. They keep shedding it. They're not infectious, like your internal virus. What do you think the long-term consequences of that are? I have no idea. Look up long-term consequences of COVID infection. They could talk about brain fog, whatever. So just because you didn't die in the first 3 weeks, and there's so many people like that, 25% of the infections. So it's not exactly wonderful that the community keeps a constant reservoir, although you've separated off the elderly. There is still something odd about this long-term infection.
So sounds like we're going to do another show and give the public an update. But you are welcome here with me on this. I know that we're hopefully educating people here and all around the world. I hope that this has that kind of reach. And I've been very appreciative of you over the years and being open to talk about things that are, I don't know what to say.
I just want to leave one message with you. Some people say, Dr. Pang, I know about long-term infections. Really? Really? Like what? Chicken pox, it might show up as shingles, but episodic, right? Oh, yeah. Well, I know about long-term infections too. Parasites. Go study the parasitic diseases that stay in your body for years. Tell me, schistosomiasis, Chagas, malaria. Tell me that doesn't affect you. It's your body response to them, right? Although the infection in you might not hurt you, your response trying to control it, you're not going to be real happy. So this disease is not well known in the long term yet. Got it?
Yeah. So I hope that you have a safe and careful.
Okay, got to get back to planning for the vaccine drive-throughs or drive-in. Yeah.
Any important things that are timely that people need to know, except follow the 6 W's and
don't go too much. If you're going to the bar, can you not do bar hopping? Go bar to bar to bar. If you're going to parties on the holidays, can you not do party hopping like New Year's? New Year's. Oh, I got to see this guy before New Year's. Hey, and then I got to go see this and this and this. I mean, wow, you got to see 5 guys. Can't you just stay here? And I finally told these people before COVID, it's kind of insulting to the host. You come here, just drink and all. I got to see these other guys. Just go one place and stay there. Honor the host. Don't do bar hopping or party hopping
or hopping.
Hopping. Yeah.
No hopping.
No hopping.
It's always a pleasure and it's fun, but we're talking about serious things. Thank you for being so clear about it. If people have any questions, is there any way they can, or where they should be looking for it? They can always try to contact through me, but do you have a spot for it?
Well, you can, actually, they've been calling my office and, try to answer.
You like the Maui Strong site? Is that helpful? MauiStrong.net, I think.
I don't know that much about them, but usually the mayor, if you call the mayor's office, he tells me these interesting and puzzling things and we try to deal with it. I can tell you, we do answer the phone. Maybe that's why they keep calling us. But
the mayor's office has not been responsive to me in a number of things, but COVID being one also.
A lot of times you can post it on their website, though. You can type in the question and say, what the heck is going on here?
Okay.
So, because sometimes the calling, it gets tied up when they're always in meetings,
I guess so. Anything else you want to say before we sign off?
Nope. Let's try to get through this without burning down relationships.
As you can see, the green frog behind me has a Santa's hat and a mask.
Yes.
That's remember Kermit the Frog? You're old enough to remember Kermit the Frog.
Yeah, but I never understood that show. He should be having 2 masks, one in each hand that you alternate, right?
It's not easy being green. Well, I know it is.
I remember that part. Yeah.
It's a pleasure having you on. Thank you for doing this. I hope you can always call me, but I'm going to call you in a while if it's appropriate. And
Sure.
Again. Okay.
Okay.
Thank you
care.
so very much for joining us.
Okay. Bye.
Thank you guys for joining us. It's always a pleasure having you here at the Neutral Zone.